Restless legs syndrome, often abbreviated as RLS, is a neurological disorder that causes uncomfortable sensations in the legs and an irresistible urge to move them. Diagnosing RLS can be a complex process, as its symptoms often overlap with other conditions. In this video, we'll walk you through the step-by-step process doctors use to diagnose restless legs syndrome, from the initial conversation to the final confirmation. Understanding this journey can help patients and families know what to expect and why each step is important. Let's begin by exploring how doctors start the diagnostic process. The first step in diagnosing restless leg syndrome is a thorough consultation. Doctors begin by asking patients about their symptoms, focusing on the nature, timing, and severity of leg discomfort. They inquire about when symptoms occur, whether they worsen at night, and if movement provides relief. This conversation is crucial, as it helps the doctor determine if the symptoms align with RLS or another condition. The doctor also asks about sleep patterns and how the symptoms impact daily life. This initial dialogue sets the stage for a more detailed evaluation. Next, the doctor takes a detailed history of the patient's symptoms. This includes asking about the onset of symptoms, their frequency, and any patterns noticed over time. The doctor may also ask if the patient has experienced similar symptoms in the past or if there's a family history of RLS. Understanding the history helps the doctor identify potential triggers or underlying causes. This step is essential for distinguishing RLS from other neurological or musculoskeletal disorders that might present with similar complaints. Doctors use specific diagnostic criteria to confirm RLS. The core features include an urge to move the legs, usually accompanied by uncomfortable sensations, symptoms that begin or worsen during periods of rest or inactivity, partial or complete relief with movement, and symptoms that are worse in the evening or at night. The doctor systematically checks each criterion, often using a checklist or questionnaire. This structured approach ensures that the diagnosis is based on established medical guidelines and not just subjective impressions. A physical examination is an important part of the diagnostic process. The doctor examines the patient's legs and nervous system to rule out other causes of discomfort, such as neuropathy or vascular issues. They may check reflexes, muscle strength, and sensation in the legs. This hands-on assessment helps identify any signs that might point to alternative diagnoses. While RLS itself does not cause visible physical changes, the exam ensures that no other underlying conditions are missed. Doctors also review the patient's broader medical history, including any chronic illnesses, medications, or recent changes in health. Certain conditions, like iron deficiency, kidney disease, or pregnancy, can increase the risk of RLS. Some medications may also trigger or worsen symptoms. By understanding the patient's overall health, doctors can identify contributing factors and tailor the diagnostic process accordingly. This comprehensive review is vital for accurate diagnosis and effective management. Restless leg syndrome can be primary or secondary. Secondary RLS is often linked to other medical conditions, such as iron deficiency, anemia, or kidney problems. Doctors look for signs of these underlying issues by asking targeted questions and considering the patient's age, overall health, and recent lab results. Identifying secondary causes is crucial, as treating the underlying condition can sometimes resolve or improve RLS symptoms. One of the most common laboratory tests in RLS diagnosis is checking the patient's iron levels. Low iron stores, even without anemia, can contribute to RLS symptoms. Doctors may order blood tests to measure serum, ferritin, and other iron-related markers. If iron deficiency is found, addressing it can significantly improve symptoms. This step is especially important for patients with risk factors like heavy menstrual bleeding, gastrointestinal issues, or chronic diseases. Beyond iron studies, doctors may order additional laboratory tests to rule out other causes of leg discomfort. These can include kidney function tests, thyroid function tests, and blood sugar levels. The goal is to identify any metabolic or systemic issues that might mimic or worsen RLS. By systematically excluding other conditions, doctors can be more confident in their diagnosis and ensure that the patient receives the most appropriate treatment. Some medications can trigger or worsen RLS symptoms. During the diagnostic process, doctors carefully review all prescription and over-the-counter drugs the patient is taking. They pay special attention to medications like antihistamines, certain antidepressants, and antipsychotics, which are known to exacerbate RLS. If a medication is suspected, the doctor may recommend adjusting or substituting it to see if symptoms improve. RLS often disrupts sleep, leading to insomnia or poor sleep quality. Doctors ask detailed questions about the patient's sleep habits, including how long it takes to fall asleep, how often they wake up, and whether leg discomfort interferes with rest. Sometimes, a sleep diary is recommended to track patterns over several weeks. Understanding the impact on sleep helps doctors assess the severity of RLS and plan appropriate interventions. To gain a clearer picture of how RLS affects daily life, doctors may ask patients to keep a sleep diary. This involves recording bedtime, wake time, frequency of leg discomfort, and any nighttime awakenings. Over time, the diary helps identify trends and triggers, providing valuable information for diagnosis and treatment planning. It also allows the doctor to monitor the effectiveness of any interventions introduced during the diagnostic process. In some cases, doctors recommend a sleep study, known as polysomnography, to evaluate for other sleep disorders that might mimic or coexist with RLS. During this overnight test, sensors monitor brain waves, heart rate, breathing, and leg movements. The results help distinguish RLS from conditions like periodic limb, movement disorder, or sleep apnea. While not always necessary, polysomnography can provide valuable insights in complex or unclear cases. A thorough neurological examination is performed to rule out other disorders that can cause similar symptoms, such as peripheral neuropathy or spinal cord issues. The doctor assesses reflexes, muscle tone, coordination, and sensory function. This step ensures that the symptoms are not due to another neurological condition, which might require a different treatment approach. The neurological exam is a key part of the diagnostic process for RLS. Peripheral neuropathy can cause symptoms similar to RLS, such as tingling, numbness, or pain in the legs. Doctors perform specific tests to assess nerve function, including checking for sensation, vibration, and reflexes. If neuropathy is suspected, additional tests like nerve conduction studies may be ordered. Differentiating between RLS and neuropathy is essential for accurate diagnosis and effective treatment. Vascular problems, such as poor circulation, can also cause leg discomfort. Doctors assess pulses, skin color, and temperature in the legs to rule out vascular causes. Sometimes, additional tests like Doppler ultrasound may be used to evaluate blood flow. By excluding vascular disorders, doctors can focus on neurological causes and ensure that the diagnosis of RLS is accurate. At this stage, doctors consider other conditions that might mimic RLS, such as arthritis, muscle cramps, or anxiety disorders. They systematically compare the patient's symptoms with those of other diseases, using their clinical experience and available test results. This process of differential diagnosis is crucial for ensuring that the patient receives the correct diagnosis and avoids unnecessary treatments. Doctors use established diagnostic criteria, such as those from the International Restless Leg Syndrome Study Group, to confirm the diagnosis. These criteria focus on the urge to move the legs, worsening with rest, relief by movement, and evening or nighttime predominance. By systematically applying these standards, doctors can confidently diagnose RLS and differentiate it from similar conditions. Before confirming RLS, doctors must exclude other conditions that can present with similar symptoms. This includes disorders like nocturnal leg cramps, arthritis, and anxiety. They review all test results, physical findings, and patient history to ensure that no alternative explanation fits better. This exclusion process is a key safeguard against misdiagnosis and helps ensure that patients receive the most appropriate care. Once the diagnosis is established, doctors take time to educate the patient about RLS. They explain the nature of the disorder, its typical course, and what to expect in terms of symptoms and management. Education empowers patients to recognize triggers, adhere to treatment, and make lifestyle adjustments that can improve their quality of life. This step is essential for long-term success in managing RLS. Doctors also discuss lifestyle factors that can influence RLS symptoms. They may ask about caffeine intake, exercise habits, and sleep hygiene. Recommendations might include reducing caffeine, establishing a regular sleep schedule, and incorporating moderate physical activity. Addressing these factors can help reduce symptom severity and improve overall well-being. Understanding how RLS affects a patient's daily life is important for tailoring treatment. Doctors ask about the impact on work, social activities, and emotional well-being. This holistic approach ensures that the management plan addresses not only physical symptoms, but also the broader effects of the disorder. By considering the whole person, doctors can provide more compassionate and effective care. Doctors use standardized scales to assess the severity of RLS symptoms. These scales help quantify the frequency, intensity, and impact of symptoms on daily life. By assigning a severity score, doctors can track changes over time and evaluate the effectiveness of treatment. This objective measurement is a valuable tool for both diagnosis and ongoing management. Accurate documentation is essential throughout the diagnostic process. Doctors record all findings, test results, and patient responses in the medical record. This thorough documentation ensures continuity of care and provides a clear reference for future visits. It also supports communication between healthcare providers and helps track the patient's progress over time. After the initial diagnosis, doctors schedule follow-up visits to monitor the patient's progress and response to treatment. These appointments provide an opportunity to reassess symptoms, adjust therapy, and address any new concerns. Regular follow-up is important for optimizing outcomes and ensuring that the patient receives ongoing support. In some cases, doctors may refer patients to specialists, such as neurologists or sleep medicine experts, for further evaluation. This is especially true if the diagnosis is uncertain or if symptoms are severe and unresponsive to initial treatments. Specialist input can provide additional insights and access to advanced diagnostic tools. Research suggests that RLS can run in families, indicating a genetic component. Doctors may ask about family history and, in rare cases, consider genetic counseling. While genetic testing is not routine, understanding hereditary risk can help with early recognition and management in affected families. Pregnancy is a known risk factor for RLS, especially in the third trimester. Doctors ask women of childbearing age about recent or current pregnancies and monitor for symptoms that may develop or worsen during this time. Addressing pregnancy-related RLS involves careful management to ensure the safety of both mother and baby. Chronic diseases such as diabetes, kidney disease, and rheumatoid arthritis can increase the risk of RLS. Doctors review the patient's medical history and may order additional tests to assess for these conditions. Managing underlying chronic diseases is an important part of comprehensive RLS care. Sleep apnea can coexist with RLS and worsen sleep quality. Doctors ask about symptoms like loud snoring, daytime sleepiness, and observed breathing pauses during sleep. If sleep apnea is suspected, a sleep study may be recommended. Treating sleep apnea can help improve overall sleep and reduce RLS symptoms. Mental health conditions like anxiety and depression can both mimic and worsen RLS symptoms. Doctors screen for mood disorders using questionnaires and clinical interviews. Addressing mental health is an important part of comprehensive RLS management, as treating anxiety or depression can lead to significant improvement in symptoms. Substance use, including alcohol, nicotine, and caffeine, can influence RLS symptoms. Doctors ask about the use of these substances and provide guidance on reducing or eliminating them if they are found to worsen symptoms. This step is important for optimizing symptom control and improving overall health. Doctors review all medications, including recent changes, to identify any drugs that might cause or worsen RLS symptoms. They pay particular attention to medications started around the time symptoms began. Adjusting or discontinuing the offending medication can sometimes resolve symptoms entirely. Periodic limb movements during sleep are common in people with RLS. Doctors ask about involuntary leg jerks or movements at night, often reported by bed partners. If necessary, a sleep study can help document these movements and guide treatment decisions. Musculoskeletal disorders, such as arthritis or muscle cramps, can cause leg discomfort, similar to RLS. Doctors perform a musculoskeletal exam to check for joint swelling, tenderness, or muscle tightness. Ruling out these conditions ensures that the diagnosis of RLS is accurate and that the patient receives the right treatment. Deficiencies in vitamins, such as B12 or folate, can contribute to neurological symptoms. Doctors may order blood tests to check for these deficiencies, especially if dietary intake is poor or if the patient has risk factors. Correcting vitamin deficiencies can sometimes alleviate RLS symptoms. Endocrine disorders, such as thyroid disease or diabetes, can cause symptoms similar to RLS. Doctors assess for signs of these conditions and may order relevant blood tests. Managing underlying endocrine disorders is an important part of comprehensive care for patients with RLS. Poor sleep hygiene can worsen RLS symptoms. Doctors discuss bedtime routines, screen time before bed, and environmental factors that affect sleep. They provide practical tips for improving sleep quality, such as maintaining a consistent schedule and creating a relaxing bedtime environment. Doctors may provide self-assessment tools or questionnaires for patients to complete at home. These tools help track symptom frequency, severity, and response to interventions. Self-assessment empowers patients to participate actively in their care and provides valuable data for follow-up visits. RLS symptoms can change over time, so ongoing monitoring is important. Doctors encourage patients to report any changes in symptoms, new triggers, or side effects from treatment. Regular monitoring allows for timely adjustments to the management plan and helps maintain symptom control. Managing RLS often involves a team approach, including primary care doctors, specialists, and sometimes mental health professionals. Collaborative care ensures that all aspects of the patient's health are addressed and that treatment is coordinated for the best possible outcomes. Doctors may provide information about support groups, educational materials, and online resources for patients with RLS. Access to support can help patients cope with the challenges of living with a chronic condition and connect with others facing similar experiences. Diagnosis and management of RLS is an ongoing process. Doctors periodically reassess symptoms, review treatment effectiveness, and make adjustments as needed. This dynamic approach ensures that care remains responsive to the patient's evolving needs and circumstances. To summarize, diagnosing restless leg syndrome involves a careful, step-by-step approach. Doctors start with a detailed history and physical exam, apply specific diagnostic criteria, rule out other conditions, and use laboratory tests as needed. Ongoing monitoring and patient education are key to successful management. By following this structured process, doctors can provide accurate diagnoses and help patients find relief from their symptoms. Research into restless leg syndrome continues to evolve, with new diagnostic tools and treatments on the horizon. Advances in genetics, neuroimaging, and sleep medicine may soon offer even more precise ways to diagnose and manage RLS. Staying informed about these developments can help patients and healthcare providers work together for better outcomes in the future.